Mr. Evans. I'm Susan. How are you?
Good, how are you?
Good. Doing some hand hygiene. Tell me your name and birthday, please.
Matthew Evans, 7684.
Good. I'm gonna close this door and give us some privacy. I'm gonna be doing an assessment today. I'm gonna listen to your hearts, feel all your pulses, inspect your legs and your arms, do a few tests, and check your peripheral vascular system and your heart. First, I'd like to ask you a few questions. Are you experiencing any chest pain or have had any chest pain in the past?
No.
Okay. Do you ever feel like your heart is beating faster at times?
No.
Does your heart skip beats or have any extra beats?
No.
Do you feel like you tire easily?
No.
Any shortness of breath or difficulty breathing? Cough, mucus production?
No.
Dizziness?
No.
Do you have to wake up in the middle of the night to go to the bathroom?
No.
Any swelling of your feet and ankles?
No.
Any heartburn?
No.
Ever had any heart defects, like as a child? Murmurs, ever diagnosed with anything like that?
No.
Okay. Any surgery?
No.
Have you ever had an EKG?
No.
Okay. Does your doctor check your lipids, your cholesterol?
I'm sure he does.
Ever had any results from that?
No. Not that I'm aware of.
And do you take any meds for your heart?
No.
Do you monitor your blood pressure at home?
Yes.
And do you keep a log of that and give it to your doctor?
No.
Okay. Any family history of heart problems?
No.
Okay. And do you smoke?
No.
Do you feel like you have a lot of stress in your life?
No.
And what would you say you eat in a 24-hour period?
Cereal, sandwiches,
Mm-hmm.
meats and vegetables.
Whatever your wife cooks at night.
Yes.
And how much alcohol do you consume per week?
1 or 2 beers.
Do you exercise regularly?
Somewhat.
All right. Thank you for answering my questions. I'm now going to assess. I'm going to take a look at the vessels in your neck. If you could just kind of chin up just a little bit, kind of relax. I'm just looking here. I can see a slight pulsation for your jugular venous pulse. If we were measuring your pressure, we would use a straight edge to measure out from where you see the pulsation to the sternal notch and measure the distance down to get the pressure. No distensions noted, no bulging or protruding. Let's look on the other side as well. Same on the left side, no protrusions or bulging, no distension noted. I'm going to take a listen. If you'll try to hold your breath the best you can when I do this, I'll tell you when to breathe. And take a breath. And hold it. Okay, you can breathe. No blowing or swishing, auscultated. I'm going to take a feel of your carotid arteries. Just a little bit of pressure. Good. Right side is 2+. No thrills noted. Left side is also 2+. Very good. Next, I'm going to feel around on your heart and then take a listen. I don't see any pulsations observed. take a feel here. Feeling your apex of your heart. Don't feel anything there. The base of your heart. No pulsations or vibrations. Palpate it. You can lean forward for me. I'll take a feel again. Lean kind of forward. Feeling again on the apex. The left sternal border. And the base of the heart. Very good. You can lay back. Just gonna feel again in each area. Skin is warm to the touch and color is even throughout. No lesions noted. Colors expected for ethnicity. I'll take a listen to your heart now. I'll listen in the aortic area, which is going to be the second intercostal space, the right sternal border. Hold your breath for me. Breathe. Hold it again. This is the pulmonic area. Breathe. Hold your breath. Erb's point. Breathe. Mitral area. Now listen here for a full minute. Good. So one more in the tricuspid area. S1 and S2 noted. No additional heart sounds. No murmurs. Going to check your pulse here. Apical rate was 65. Radial rate is 64, so that's spot on. Rhythm was regular, no skips or arrhythmia noted. No murmurs. I could get you to lay on your left side. I'm gonna listen again. Lift your arm. There, good. Good. And lay back on your back. I'm gonna have you sit straight up and lean forward slightly. I'm gonna listen again. Good. You can lay back. Okay. So that's it for listening to your heart. Now I'm going to do some inspecting of your arms and legs. Just hold out your arm. Good. Color is warm to the touch. It's even. Skin tone is even and expected for ethnicity. No edema or venous patterning. Capillary refill is less than 2 seconds on the right and less than 2 on the left. Okay. Check your radial pulses. Radial pulses are strong 2+ bilaterally. Checking your ulnar pulses. And they are strong and equal bilaterally. Okay. Take a brachial pulse. Strong 2+. Good. Strong 2+. Straighten your arms out. We'll feel for your epitrochlear lymph nodes. Which are non-palpable. I'm going to do what's called an Allen's test. I'm going to occlude both your radial and your ulnar arteries. I want you to clench your fist. Unclench. Ulnar return is less than 3 seconds. Alright, I'm going to repeat this one more time. This time I'll let go of this thumb. Clench your fist. Relax. Radial return is less than about 3 to 5 seconds as well. On the right, we'll do this again on the left. Clench your fist. Release. Ulnar return is about 3 seconds. Do it again. Relax. Radial is about 3 seconds. Very good. I'm going to go and look at your legs. I'm going to roll up your shorts here and get a little personal. Legs are warm to the touch. No lesions. Lacerations noted. Skin is evenly distributed bilaterally. Skin is appropriate for ethnicity. Just gonna feel here for your inguinal lymph nodes. They're about palpable, 1 to 2 centimeters. I'm going to listen to your femoral arteries. No sounds noted from the femoral arteries. Make sure it's back down. Okay, I'm going to check your pulses. Dorsalis pedal pulses. Very strong, 2+ on the right. Strong, 2+ on the left. Think of the name for these pulses in a minute. They are strong, 2+ bilaterally. And that is the posterior tibial pulse. I'm going to bend each knee up. Feel for your popliteal pulse. Which is not palpable on the right. Not palpable on the left. Next, I'm gonna have you stand up. I like to take a look at your legs when you stand up. Veins are flat, no redness or discoloration. Skin color is distributed evenly. Any tenderness when I'm touching your legs?
No.
Can you lay back down for me? One last thing we're going to do is called the positions test. I'm actually going to raise your legs up. I want you to pump your feet the best you can. I'm going to kind of wait till your legs turn a little pale, and then I'm going to have you dangle your legs over the bed. Okay? And pump your feet. Try and get all that venous blood out of there. Good. Alright, now let's dangle them over the side of the bed. Good. Return is about less than 10 seconds, so that's good.